Question number 1. A 12-year-old boy was brought to the emergency unit. Respiratory arrest due to drowning. Cardiac resuscitation was done. What is the major complication that might happen if treated after drowning quickly? A. Sepsis, B. Alkalosis, C. Acidosis, D. Hypothermia. The answer is C. Acidosis. Question number 2. An ICU nurse reviewed the chart of 47-year-old man, patient with mechanical ventilator for a long time. Arterial blood gas result as below. What condition the patient is experiencing presently? A. Metabolic acidosis, B. Metabolic alkalosis, C. Respiratory acidosis, D. Respiratory alkalosis. The answer is C. Respiratory acidosis. Question number 3. Gastric suction can cause A. Metabolic acidosis, B. Respiratory acidosis, C. Metabolic alkalosis, D. Respiratory alkalosis. The answer is C. Metabolic alkalosis. Question number 4. ABG reading was low pH, high PCO2, normal HCO3. What is the interpretation? A. Compensated respiratory acidosis, B. Uncompensated respiratory acidosis, C. Metabolic acidosis, D. Metabolic alkalosis. The answer is B. Uncompensated respiratory acidosis. Number 5. The nurse assesses a client with an ileostomy for possible development of which of the following acid-base imbalances? A. Respiratory acidosis, B. Metabolic acidosis, C. Metabolic alkalosis, D. Respiratory alkalosis. The answer is B. Metabolic acidosis. Question number 6. A nurse reviewed the chart of 42-year-old man whose ABG analysis report is shown pH 7.2, PCO2 35, HCO2 20. Which of the following the most likely interpretation of the finding in the report? A. Respiratory alkalosis, B. Metabolic acidosis, C. Respiratory acidosis, D. Metabolic acidosis. The answer is D. Metabolic acidosis. Number 7. The nurse is assigned to care for patient with Cushing syndrome on adrenal corticoid hormone syndrome. pH 7.2. Which of the following conditions should nurse expect to patient? A. Respiratory alkalosis, B. Respiratory acidosis, C. Metabolic alkalosis, D. Metabolic acidosis. The answer is D. Metabolic acidosis. Number 8. A 20-year-old woman, a case of panic attack, comes to the emergency department. An arterial blood gas analysis is done with pH 7.53, HCO3 27, PCO2 27. What is the most likely? A. Metabolic acidosis, B. Metabolic alkalosis, C. Respiratory acidosis, D. Respiratory alkalosis. The answer is D. Respiratory alkalosis. 9. A client was admitted in emergency room due to mild metabolic acidosis associated with dehydration and potassium. The doctor administered Hartmann lactated ringer intravenous fluid and electrolyte replacement. Which of the following element of the lactated ringer solution highest value? A. Calcium, B. Sodium, C. Potassium, D. Magnesium. The answer is B. Sodium. Question number 10. Ringer lactate considered as which type of IV solution? A. Hypotonic, B. Hypertonic, C. Isotonic, D. Hyperalimentation. The answer is C. Isotonic. Number 11. Physician orders an intravenous fluid of DNS at 100 cc per hour. This is an example of which of the solution? A. Hyperalimentation, B. Hypertonic, C. Hypotonic, D. Isotonic. Question number 12. 13-year-old patient is admitted for diarrhea and vomiting. He looks pale and lethargic. A nurse is preparing to give IV hypotonic solution. Blood pressure 110/70, heart rate 76 per minute, respiratory rate 18 per minute, temperature 36.1. Which IV solution is the most appropriate? A. 0.9% saline, B. Lactated ringer, C. 10% dextrose in water, D. 0.45% sodium chloride. The answer is D. 0.40% sodium chloride. Question 13 and 14 about CPR. The CPR depth is 1/3 of the chest, 1.5 inch for an infant, and in adult at least 2 inch but no greater than 2.4 inch. Number 14, CPR site, you can see from the picture. Which one CPR technique is right? The answer is A, 30 compared to 2. 16. You are performing CPR on an infant when a second rescuer appears. What is the next step in management? A. Immediately transport the patient. B. Wait until exhausted, then switch. C. Have the second rescuer help with CPR to minimize fatigue. D. Have the second rescuer begin ventilation, ratio 30 compared to 2. The answer is C. Have the second rescuer help with the CPR to minimize fatigue. 17. What should be your first concern at a scene where a person has been seriously burned? A. Checking the scene for safety. B. Checking the victim breathing and pulse. C. Calling your local phone number. D. Cooling the burn area. The answer is A. Checking the scene for safety. 18. While performing cardiopulmonary resuscitation on 5-year-old child, the nurse palpates for pulse. Which of the following site is best for checking the pulse during CPR in a 5-year-old child? A. Femoral artery. B. Carotid artery. C. Radial artery. D. Brachial artery. The answer is B. Carotid artery. 19. After activating the emergency call system, what should be the next immediate action? Please see the picture. A. Initiate ventricular pacing. B. Administer bolus of lidocaine as prescribed. C. Defibrillate the patient. D. Open the patient's airway. The answer is C. Defibrillate the patient. 20. A nursing instructor teaches a group of students about basic life support. The instructor asks a student to identify the most appropriate location to assess the pulse of an infant under 1 year of age. Which of the following, if stated by the student, would indicate that the student understands the appropriate procedure? A. Carotid. B. Popliteal. C. Radial. D. Brachial. The answer is D. Brachial.